Hello, ladies and gentlemen. Today we're going to talk about spina bifida. This is on my mind because we just kind of had a case with it. Did a C-section. Overall, mom did good. The other puppies did good. One of the puppies had spina bifida. So figured that'd be a good video because it's not a super common thing and somebody might be interested in it. So here we go. All right, guys. So spina bifida is a congenital problem of the spinal cord. And basically what it is during the fetal development, the neural tubes don't fully develop, and the easiest way to explain it is the spinal cord is exposed at birth. So normally I'll kind of explain the spinal cord like layers of an onion. You get layers of an onion, deeper layers have different nerves and different things that we look at, but you get the vertebrae around that. Then you kind of get the muscles, then you get the connective tissues, then you get the skin, and then everything looks good and is protected from the outside environment. But in spina bifida, for whatever reason, genetically, it comes together, but instead of fully coming together, it stops right there. And there's varying degrees of this. Generally, most of the ones that I've seen tend to be in the lower back, kind of in that T3 or T13 to lumbar vertebral bodies, so kind of lower back for those that aren't familiar with that. And there's varying degrees. Some degrees are you can see the whole spinal cord, some you get the bone development but none of the muscle and stuff over it, and just the list kind of goes on in varying degrees from all the way normal to basically nothing developed and there's no nerves past that point. So this disease can vary quite a bit. Unfortunately, in my experience, when we've come across them, most of those puppies tend to have other genetic abnormalities, and most of them don't seem to survive very long. I have heard of some surgeries that can be done. Yeah, that would probably be more with the specialist of some type, whether your area has a neurospecialist or surgery specialist. Like I said, a lot of times, even surgery is not that common. I don't know if they have very good outcomes with it. So, if you're interested in it and you have that problem, yeah, you'll probably have to actually talk in a little more detail and probably need to be willing to kind of do MRI or CT to see if it's even worth going in surgically. Because ultimately, even if they can fix the outside, if there's no nerves that go to the back half or past that point, there's no real point in doing the surgery. And that question's just above my head. But a lot of times these other puppies, they have disformed legs and different things like that. Some of them can live. I just haven't seen very many of them. But also by the time I'm seeing an older patient and not puppy, they might have kind of scarred over and granulated and healed, and it just comes down to how manageable are they. A lot of these puppies will have incontinence, both urinary and bowel control, fecal incontinence. A lot of them can't use the back legs very well. In the particular ones that we saw, a lot of the legs are just really disformed and kind of tucked up and in, and even the wrists or the paws are really disfigured. For those patients that do survive, or the owner can afford to kind of pursue a high maintenance patient and get through the initial birthing process and survive the normal things and those extra things, one of the things that you got to worry about is secondary sores from dragging themselves. Once again, this all varies. Sometimes they have one good leg or one that's functional and they don't have to drag, and it's kind of like a tripod or a three-legged patient, no different than an amputation. But there's just so many unknowns with the neurologic function and where are they going. Those nerves in that spine go to multiple areas. They don't just go to the legs. Hence, the fecal incontinence, the urine incontinence. Those nerves also go to the bladder. They go to the colon. They go to the rectum. They go to the intestine. They go to the muscles, the nerve, the skin. They kind of go everywhere else. So there's just a lot to overcome with them. For those patients that are surviving it, doggy wheelchairs are probably going to be a must for most of them. There's a variety of ways to go about that. Some people will do a DIY and build their own. There's custom orthogonal. There are veterinary specific ones, but that's not generally a one-size-fits-all. So you got to be a little particular, and I would just say touch base with your veterinarian if you're unfortunately in that position and trying to move forward with it. So hopefully that helps a little bit, guys. Just kind of an unusual, odd case that came across, and we come across them every once in a while. They're not super common, but kind of wanted to share it with you because that's what's going on. Thanks, guys.